I think for most couples, it's an incredible shock. In this day and age, we have wonderful technology to do testing and to do scanning, and for a lot of couples, they believe going and having those tests is their opportunity to meet their baby inside, and many of them don't even expect it to be a diagnostic test. And so if they get that news that there's some serious condition with the baby, their initial reaction is just one of shock. And I think when people are shocked and something's unexpected, there's been no time to prepare for it. Often the decisions they make then can be quite reactive, and so often the first reaction is, let's just deal with this quickly. People often need a bit of support though in that period of the diagnosis or the waiting period, because people often jump onto the internet and Google things and scare themselves with the information they find out, and it's not always, as we know, accurate. It's very hard to be a mother and to try to protect your unborn child, and so you can feel very helpless as a mum. Some mums at times will feel guilty. We're responsible for this. Particularly genetic diagnoses are hard because couples know that it's their genetic makeup, and even though they had no say in what their genetic makeup is, they feel this responsibility. What I find though is if parents are well supported, they're actually the best people to support their children anyway. And so often what parents need to actually know is, how do I talk to my children about this? Some couples find there's such a private time that and I often suggest to them to shrink their world at a time like this. So for some it will be very intimate and very small, and it may be just grandparents. Other families are different than that, particularly big open families, and some couples will actually choose to have lots of people, families and some important friends actually come and meet the baby. People initially think that it's just going to be a terribly sad experience, and yet the reality is I've seen lots of laughter and lots of love and lots of beautiful sense of family and friends coming together. Who are the health professionals who are looking after this woman for her pregnancy? The midwife, the local obstetrician, the local GP, and talking to them about, let me know what my choices are. How can you support me in being able to continue on with this pregnancy, to be able to give birth to this baby? How can we actually do that in our local community? Having good family and friend support's important. Most people approach pregnant women and ask them, when's the baby due? How many children do you have? And so it can actually be very difficult to meet with, the lady behind the counter in the chemist and have to explain to her that you're carrying a child that's not going to survive. So one strategy that's really important is, who do these parents contact when they're concerned? They need to know that 24 hours a day that they have access to someone that they can come and have a check if they've got concerns and worries. Certainly taking a baby home that's going to die is an option that we like to be able to provide for our families. Parents often feel that they wouldn't do it, but given the opportunity, it's amazing how many of them will actually change their mind. And this is one of the most amazing experiences that parents can have. I think it starts with a lot of fear, but what most parents that I've been involved with tell me is that they find this incredible strength. They live their own integrity often. They allow themselves to fall in love with their child and parent this child. The bittersweetness of loving a child who dies, parents often find that they have courage and strength that they never knew they had.